Hello, everybody, and welcome in. I am Dr. Marianne Pinkston, and this is The Better Life with Dr. Pinkston. That's what I'm trying to do, is help so many people figure out their health and their wellness, mind, body, spirit, all those things in a more integrative fashion, which is becoming more and more popular these days, a functional medicine, integrative medicine style of getting to the root cause of your issues instead of putting on the Band-Aids from the pharmaceutical industry, the food industry, and all of the things that we are learning more about and fighting these days, trying to get our health back. And today I wanted to refocus again on hormone health. This is the question I think I get the most. So it's time to readdress it. I have been doing this for 3 years now. If you can imagine, this month, 3 years. And I think when I first started, my third or fourth show was called The Hormone Myth. And being 3 years ago, I thought it was time to bring this topic back again because I'm asked so much about it. And I think hormone health is on the sideline when it should be at the forefront. I was talking to a patient the other day who was explaining that she wishes her mother would do hormones, but her mother felt very resistant because she's heard a lot of myth and a lot of bad news about how hormones can hurt you. And she basically wants to spend the rest of her life aging naturally. And I need to let everybody know that there is nothing natural about aging without your hormones. So your hormone health is important to natural aging. So I want to spin that myth around. And guys, don't worry, I'm not just talking women today. I want to talk about, the male hormone myth as well, because hormones, whether you're a male or a female, are there to improve your life, to improve your longevity. And I think if we look at the things that we are most frightened of these days, so weight gain, dementia, cardiovascular health, so heart attacks and strokes and all of these issues, those are the things that we are most frightened of. These are issues that start back in our 20s and 30s. And even our hormone health starts to lower in our 20s now. I can't tell you how many men I test for testosterone in their 20s, and their testosterone is well below 200 or even 300. And your normal testosterone should be 900 to 1200. And for you women, the same thing. It is very well studied that your hormone levels and your testosterone levels should be 250 to 350, and many women are anywhere from 0 to 70 quite frequently. Now, if you go to your doctor's office, if your doctor tests your hormones, you're very lucky. But when they test your hormones, they will look at the sheet of paper or the screen that comes in front of them and use the laboratory's reference ranges to guide them on whether your hormone levels are normal. Most laboratories list their normal ranges for women as 0 to 70 or somewhere in that range, or for men anywhere from 200 to about 700, maybe 900. But these reference ranges are not truly reference. They are a population average, and the population is not well, and therefore that skews the numbers and brings the averages lower and lower. So if you go and you have your labs checked and they are low like that, you are in line with the rest of the sick population. You are not in the true reference range of where your labs should be. And many physicians argue with me about those reference ranges, but hormones have been studied since the 1930s. The type of hormone treatment that I use mostly pellet therapy, but there are other forms, and we'll go over that. But that technology has been around since the 1930s. We have tens of thousands, and I've been saying that for 20 years, so I'm sure there's hundreds of thousands of studies now that show that hormones, especially when used on a natural basis, are exceedingly safe. In fact, really, I have not seen any type of study that shows that hormone health can be detrimental when done the right way in any shape, form, or fashion. Again, as long as it's natural. So there are synthetic hormones, there are natural hormones. Most physicians, gynecologists, family practice, endocrinologists, most of them use more synthetic hormones made by the pharmaceutical industry. So there have been studies done by the pharmaceutical industry and others on synthetic hormones that have, yes, shown harm. These studies are not to be intermixed with the studies that have been done on natural hormone replacement. Natural hormone replacement has very, very little downside, and we will go over those things in just a few minutes. So in use of synthetic hormones, and I want to spend a few minutes on that because that is truly what's most widely used. So I'm going to use some brand names here, and shame on me, but things like Prempro, Premarin, those are estrogens and progestins that are made from horse urine, basically. And there are other types of injectables. There are the estrogen injectables. There are testosterone injectables, testosterone cypionate. Even testosterone cypionate is made into a pellet, which has been something that has competed with me for some time. Many insurances cover a lot of these hormones, but they are, again, synthetic. So what does a synthetic hormone mean? A synthetic hormone means that you are taking in a substance, a chemical, that is not recognized by your body as natural. Your body takes it in, it goes through the liver, and it gets metabolized and changed into another form. Therefore, that is not natural to your body. A natural hormone, when taken in, either sublingually, topically, or by pellet form, your body recognizes that as something it made. It doesn't have to go through the liver, so therefore it's not changed into something else. Therefore, your body takes it and recognizes it as something it made. Most of the natural hormone therapies are made from a yam. Yes, a sweet potato, basically. It's plant-based. So again, this is something made from nature, given to your body to act as nature would, and perfectly natural. The studies are extraordinary. What we show is that using natural hormones decreases your heart attack and stroke risk. It improves cholesterol. It decreases insulin resistance. It improves your muscle building and your muscle function. It improves the ability of your neurons and the brain to, rejuvenate and stay active. It reduces the dementia effects, reduces osteoporosis. So when your bones are thinning as you get older and you wind up, with your 90-year-old grandma winds up in the hospital with a back fracture or a hip fracture, winds up in a nursing home and passes away. This is an enormous part of what causes women to die and die before their time is osteoporosis. So all of these factors are improved by taking natural hormone replacement. So if you want to age naturally, ladies, men too, then you're going to age by increasing, and you don't do hormones, you're going to increase your risk of heart attacks, strokes, osteoporosis, dementia, and all of those things naturally. And that is just something that does not have to happen. When we give you hormone replacement, we want to give it back to you in the amounts that are natural to your body. We don't want to give you these what we call super physiologic levels. We don't want to take your levels beyond what they should be. And again, like anything, if you do things the right way, you're doing something absolutely positive for yourself. When you do it the wrong way, well, then yes, there's going to be some consequence tied to that, natural or not. But when you see somebody who is fully qualified to treat you with natural hormone therapy, you are already on the mode of success to improve your longevity and reduce your aging and your risk of death overall. Now, to go back to the natural versus synthetic, if you use synthetic hormones, yes, they give you some of the benefits. So you can build muscle. You can feel much better. Your brain works better. Your energy is good, and all these factors do play in. So many people are quick to go and get the testosterone injections because they do feel so wonderful. But the downside of that is having a chemical, again, that your body doesn't recognize metabolized through the liver. And those things can increase your red blood cell count. It can increase your cholesterol. Some men can have problems with their PSA or their prostate hormones. There are many factors that can come from taking too much of the wrong type of hormone and something non-natural. Those are things I do not see when used appropriately. I do not see with natural hormones. I have been treating patients naturally for 10 years, I just don't have the problems that I see on the synthetics when I use natural. Part of the thing that I see a lot with using synthetics, especially in men, is that their estrogen levels go astronomical. Now, estrogen is not a bad hormone. It is demonized highly, but it is not a bad hormone. Estrogen reduces heart attacks and strokes, and this is in men and women, improves bone function and bone building. It keeps your muscles strong, your insulin levels low. It keeps your blood sugars normalized. It keeps all of your other hormones functioning well. It actually prevents cancer, not causes it. So women, when you talk about getting hormone replacement with estrogen and you're fearful of a cancer risk, estrogen, especially in the natural form, does not cause cancer. If you have a cancer in the breast, men too, if you have a cancer in the breast and you are getting a more inflammatory, wrong type of estrogen, or you're getting a ton of estrogen and those cancer cells have estrogen receptors, then it will grow it, but it will not cause it. So we do a great amount of screening, making sure that, women do not have tumors underneath before we treat. But again, you do not have to worry about the cause of cancer. So you're reducing cancer risk in men and women, both with estrogen levels aboard. The problem comes when you get too much estrogen and you get too much of the wrong type of estrogen. That is when the problem occurs. That is when you get more inflammation and more problems with cholesterol and more problems with, growing cancers and other issues that can come up from estrogen. That's when the problem occurs. It's called estrogen dominance. Now, I have a show on that. If you go back probably about maybe almost a year ago, 9 months ago or so, it's called PCOS, menstrual irregularities and estrogen dominance. That is something that men and women can listen to and understand how estrogen dominance works. I'll sidestep that for a moment. But again, I just want you to understand that estrogen is demonized highly. And estrogen that is demonized comes mostly from the pharmaceutical versions. They are not true estrogen, and they are not plant-based and not natural to the body's chemical structure. Now, women, often I will say you need testosterone. And women look at me sometimes like I have a third eye on my head and think, this is a male hormone. Why would I use testosterone? Testosterone, again, like men need estrogen, for their cardiac and bone health, etc. Women need testosterone just the same way. Men need less estrogen, women need less testosterone, but we still both need those hormones. So testosterone begins to fall in men and women in your late 20s and starting early 30s. With every decade that passes, you lose 10% of your muscle mass. So imagine you get into your 50s and 60s and you've lost, 30% of your muscle mass, then that is the true form of aging. That is where people begin to say, well, I went through menopause, now I'm gaining all this weight, and it's because of menopause. It's actually no. It has nothing to do with menopause, to a certain extent. But it has to do with the fact that you have lost that much muscle mass because you've been going through premenopause since your late 20s. So that is the reason why you have problems. I see most women have the problems about their mid or late 30s when they come into the office and say, I cannot think. I go into a room. I don't know why I went in there. I have brain fog. It's like pushing my thoughts through Jell-O. My energy is gone. My sex drive is completely gone. My marriage is in trouble. There are, my muscle mass. I can't lose weight. There are so many things that come up, and it's about the mid to late 30s when that happens. So when that happens, I check their testosterone levels. Sure enough, they're usually below 50 or even 70 at some point. And I explain your testosterone levels should be 250 to 350. This is where your sex drive comes from. This is where your muscle mass comes from. Your ability to lose weight is in your muscle mass. Your anti-aging is in your muscle mass. This is how your brain functions and your energy comes. And of course, there's other things that play into this. Hormones are not the only thing you should concentrate on for your health and well-being. But this is a huge factor, especially in the lines of having difficulty with your marriage. So you can get all of that back. It's exceedingly simple. And I think once I help people get past the understanding of synthetic versus normal, natural hormones, once I help them understand where their levels should be and that the studies and the safety are behind all of this, almost everybody is in line and winds up going through testosterone therapy. I use a pellet. It is a tiny little, maybe much smaller than a Q-tip head, a very tiny little pellet. It is made from a natural form, again, plant-based of the hormone, and it's more in a dry form rather than in a topical cream. And all we do, instead of putting the cream on top of your skin, I put this form right under the skin. It doesn't go into muscle, bone, nerves. It doesn't cause excessive scarring. There are some people with darker skin who they can see where I have placed, used a small tool to place the pellet underneath, but it's a very tiny little place. I put it in places where, your bikini line won't show. And I don't think really anybody cares. It ultimately is like a medium-sized mole is what it amounts to. I have very few, we do use a sterile technique in order to get the pellets in and do the small procedure. And it heals very well. We don't use stitches. People have, low risk of infections. Sometimes the pellet acts like a little splinter underneath the skin and tries to come back out. That happens once or twice. But all of these things are very, very low risk. The other thing that people worry about are side effects. So if you have a natural hormone on board, your body thinks it's a natural substance, and we give it to you back in natural levels, your body doesn't have side effects to that. It thinks it belongs to you. So there really is no side effect. The things that happen to people, so sometimes people, especially on the synthetics, will explain that they have some water retention, agitation. They'll report, either feeling more tired or, having difficulty with weight gain. These are all issues of synthetic hormones. They're issues that they've been treated. Probably their levels are too high and they're making more of the wrong type of estrogen. So you hold water more and you get agitated with high levels of estrogen. So if that explains things to everybody, I don't know what else will. But as long as you are given back the right form with the right amounts, these are things that don't happen. Only two things happen to women that they are very concerned about, and it's not as frequently as you might expect. It is actually not because of testosterone. It's just because of hormone replacement in general. If you have synthetic or natural, and I replace your hormones, and you make more of another hormone called androgen, then yes, you will experience acne, oiliness, and some hair loss kind of in the male pattern area. And that is not due to testosterone itself. Whatever hormone you replace, whether you take an over-the-counter DHEA, whether you just make more hormones on your own, whether you take a birth control pill, whether you take, natural hormone replacement, you're going to do that anyway. Even if you make your own natural levels of hormones, that's going to happen to you anyway. So there are ways of dealing with that, and I help women with that. I will tell you personally, I have done hormones for 10 years. And I have a little bit of the male, I make a lot of androgen. And I have had a little bit of hair loss. I do get acne, but there are ways of dealing with that you wouldn't notice. I don't care if I will say this very bluntly, but I don't care if I walk around bald, I'll wear a wig. If I have giant pimples on my face, I am a giant pimple myself. I am fine with that. My life and my quality of life are so normalized by taking hormones. I can think, I can take care of my business and my kids. I have a great marriage. There are lots of wonderful things, especially looking into my future. I have rheumatoid arthritis and I have a long history of cancer and diabetes and obesity. Those things are not in my future because I take care of myself, and I plan to, continue to build my athletic build. If you've looked online, you've seen what I've done over the years with my weight loss and my athletic build. I have every ability to thank hormone replacement for a lot of those factors. So this is something that's very, very important, very, very life-saving, and I definitely want people to take advantage of it. But you need to understand and know that there are differences in types of hormones. I talked a little bit about the estrogen dominance, and I think that is something that needs a lot more attention. I see women who go into their OB-GYN, they're having very heavy periods. They are having fibroids. They have, infertility, PMS, acne, migraines. There are so many different problems. Endometriosis, let me mention that as well. And have great difficulty with PCOS, which means insulin resistance. So some women don't have periods as opposed to having very heavy periods and are put on a birth control, so an oral birth control pill. This is fake estrogen or synthetic estrogen. It's also synthetic progesterone. Synthetic progesterone is called progestin. It's not progesterone. And if you are taking something that is purchased from a regular pharmacy that is labeled as progesterone, it is not. And that is something that adds to the hormonal issues that women have when you're taking something that is false and, again, a chemical substance rather than a natural substance. Progesterone is something that I use on women even if they don't want to do estrogen or testosterone replacement. Progesterone is something that I will use often for anxiety, especially at night, and lack of sleeping. For these irregular periods, of course, we have to talk about doing some changes to the environmental toxins that you're exposed to that act like false hormones in your body, act like false estrogen. But natural progesterone is something that offsets that quite nicely. It is best purchased through a compounding pharmacy. I work very closely with compounding pharmacies, and it is best used orally at night. There are some creams that work as well. And so, again, progesterone can help a lot with heart palpitations in women and a lot of heart symptoms. Estrogen, progesterone, and testosterone, those are the three hormones that are very, very important in building bone, maintaining its strength, and improving bone density over time. All three of them are involved in your muscle mass, your reduction of cancer risk, your reduction of heart attacks and strokes. We even use progesterone in a lot of neurological disorders. So people who have multiple sclerosis or MS, I use progesterone to improve their nervous system function. There's so many uses of natural hormones, not just exclusive to hormone replacement. We have a very valid place for improving your cardiovascular health and your neurological health, your prevention of cancer, bone health, just your general anti-aging and longevity. All of that is included. So the other topic that I want to discuss here in just a few minutes, I do need to pay homage to Magna Pharmaceuticals and Dr. Lesser, who will be on the show next week, for the help and assistance that they've given me in being able to bring this show to you. So I'm going to step back for just a few minutes. But first, I do want you to go back and look at some of my previous shows. If you will go to drpbetterlife.com, you can see almost, 300 shows now. It's amazing that I've been able to do this over this last 3 years, and I thank you all very much for tuning in. So drpbetterlife.com. We'll be back in just a few minutes.
Depression, anxiety, low energy, weakness, these are just some symptoms of low B12 levels. And the absorbable B12 folate supplement that's helping people declare victory over depression symptoms is De Novo Plus B12 by Magna Pharmaceuticals. Patients with symptoms of depression often exhibit low levels of folate and vitamin B12. The human body needs sufficient folate intake to produce the essential neurotransmitters serotonin, dopamine, and norepinephrine. These neurotransmitters alleviate feelings of sadness, anxiety, and gloom. What makes De Novo Plus B12 so successful? De Novo Plus B12 contains readily absorbable folate and B12. That means it's more successful at correcting the root cause of your deficiency, not just the symptoms. Whether you are suffering with low energy, depression, fatigue, or anxiety, you owe it to yourself to learn more at magnaweb.com. That's magnaweb.com. Please let us know at checkout that you heard about De Novo Plus B12 on The Better Life with Dr. Pinkston.
Okay. Welcome back, everybody. I'm Dr. Marianne Pinkston, and we are talking hormone health today and addressing all of the myths that I am hit with every day when I sit down with a patient to talk to them about treating their hormones. This is not the 30 minutes to blast the pharmaceutical industry by any means or other physicians. I want you to know you always need to go and talk to your physician that you know and trust about your hormone health, but I just think that it is important for people to understand that it is an alternate way of doing things. And so I mentioned the pellet therapy, and the pellet therapy is my favorite. It's my favorite for a reason. With men, I can actually place a few small pellets underneath the skin. It's up in the upper outer buttock area, and it lasts for about 5 to 6 months. So you only have to come in twice a year and have it done, as opposed to going to a place every 2 weeks to 4 weeks or so and getting an injection done or doing it yourself. And for women, it's approximately every 3 months, about 2.5 to 3 months. What we do is we look at your weight and your levels, and we have a calculation that we do. And to give you the right dosage, very rarely do I ever have to change the dosage up or down. Most of the time we have to change it up a little bit, but rarely ever have to go down. It is not a painful procedure. Don't let that intimidate you. Again, it's in the upper outer buttock, and a little bit of lidocaine kind of numb the area, and then they're just placed right underneath and put a steri strip on and a bandage, and you're done. You can go about your day as if nothing happened. Couple of days, you begin to feel something different, and it is wonderful. Your energy comes up, your sleep gets better, your anxiety gets better. The sex drive begins to increase. There's so many wonderful benefits from using it in just a couple of days. You peak out in a couple of weeks, and then it becomes starts to come down a little bit. But all we do is catch you right before it goes too low, and put the pellet therapy in again and send you on your way. So women 4 times a year, men twice a year approximately, and you're set. The expense. So many people argue about it being expensive. This is something that you have to know bothers me in a way that we spend so much money on things that do not align with our health. So we go out to eat, we purchase fast foods, we purchase tons of vitamins and supplements trying to feel better. So much money goes down that rabbit hole. And there's so many things that we could do, especially our coffees in the morning and things like that, to save money. That's what I did. I gave up Starbucks, and that paid for my hormone therapy. Yes, I have to pay for it too. And it's equivalent to about $30 a week. So what is $30 a week that you could set aside for yourself in something you shouldn't be doing that would save your life and make you feel better? When I mention that, most people are ready to just say, okay, I think I can afford this. And you can. You just need to do better for yourself. It's a tough decision sometimes. I think the fear affects people. So hopefully we're alleviating some of that fear today. There are alternatives to the pellet therapy, and that is the creams. So creams are okay. Actually, creams have been very, very well studied. That's probably maybe more studied than pellet therapy, although they're exactly the same. One can be really exchanged for the other, except for I feel like the skin is a barrier. It's meant to keep things out rather than put things in. And there are so many times where you can put them on inappropriately so that they don't absorb correctly. I know when I used the creams way back in the day that I would skip nights because you have to, rub the cream in for 2 minutes at a time to get it to really absorb correctly. I'm tired and I'm going to bed and I don't want to do that. I also thought it took a long time for it to kick in. And sometimes I just wasn't really sure if it was helping me or not. Now, that is not to say it doesn't work, because it does. And again, there are many studies that show it does. So if that's what you prefer, absolutely. Again, the safety and efficacy is behind it. It's a little bit harder to test in the blood. So sometimes you feel like you're shooting in the dark, or I feel like I'm shooting in the dark with it. Whereas pellet therapy, I know when you feel better. I know when you don't. It takes no time for it to kick in. I can test labs and find what it's doing for you, and it's very, very straightforward and very easy to do. You also don't have to spend a lot of time injecting or putting something on. There is oral therapy, so compounding pharmacies make things called troches, which can be placed under the tongue, but I do feel like people still swallow some of the hormone. Then if it goes through your stomach, It still has to go through the liver. And I do think there is some loss of efficacy there and maybe some slight risk. But again, that is just an opinion. So there are different ways of doing things, and you just have to find what aligns with you. In finding somebody who does it, so our clinic here in San Antonio does it. I have a fantastic nurse practitioner that I've trained for almost 6 years, who is very integratively trained and knowledgeable. And he understands hormones probably better than I do at this point. He has really studied and done very well. And so he can do that there at Pinkston Medical and Wellness. You can look for us online. Just go to drpbetterlife.com. It's there. And you can also call 210-698-7825. But if you're not in San Antonio, I generally will ask you to look for a good compounding pharmacy in your area. Up in Austin, that's PD Labs. Those are my friends up there. The Laval Performance Health Center, they can talk to you about various physicians that are local to you. And then for my nationwide folks, I send you to A4M, the letters A as in Apple, the number 4, and M as in Mary.com, A4M.com, and go to the Find a Provider service. There are providers all over the United States that can help you find a physician that does more natural types of hormone therapy close to you and your area. So that's a way of finding somebody good and somebody reliable. The A4M has many, many physicians nationwide, and lots of information too. Other places where you can look for information, there is a fantastic book by Pamela Smith, Dr. Pamela Smith, and I've had her on the show previously, and you can find her book about women's hormones on Amazon, and that is an eye-opening experience when you read all of the pluses behind women's hormones, and she explains all of them in great detail. So that is another fantastic place where you can find fantastic information. So I hope that I have put to rest some of the myths and things that confuse people and make people worry and feel uncomfortable about doing something really wonderful for themselves. Natural hormone replacement is very safe. It's been around for decades. Once we get to 2030, that's 100 years of science behind natural hormone replacement. And it is extremely effective, life-saving, and it is affordable. Don't let that discourage you at all. I am happy to have gone over it with you. Please check out some of my older shows at drpbetterlife.com and more of my information. I hope everybody has a wonderful week. We'll see you next time.